Okay, so we're going to have part two here of the syllabus review. And so I'll just run through the topical outline. What I tried to do is denote things that were a graded assignment with an asterisk here on the right side to kind of just say, hey, pay attention to me, right? So those things will be graded. So for week one, which we're currently in, we'll be doing an introduction. We'll review the syllabus. We're going to look at family theories, harm reduction, health promotion, disease prevention, and immunizations. So for the books here, you have your chapters listed: Dunphy, Chapter 3, the Cash and Glass, Chapter 1, and there is under Section 1, which is all the way in the back, Adult Preventative Healthcare. And use the additional resources in Chapter 1, in Module 1. There will be a lot of videos and things every week that will help point you to kind of what we want you to have for the information, such as like for this week, the U.S. Preventative Task Force, things that we spoke about in the immersion weekend, right? So for your scheduled assessments, you have your introduction, and then you also have a discussion board. So the post each week will be due by Wednesday at midnight, and you'll reply to only one classmate by Sunday at midnight, and that is when the week will close. You'll also have a weekly quiz, like we said before, and so that quiz will be due on Sunday. It is open the entire week. However, I want you to do all the readings and the video watching and the discussion board prior to taking that quiz. Okay, so I would say plan your week for doing the discussion board first, the readings and then the discussion boards, and then follow up with the quiz. Now, when you go into the modules in Canvas, you'll see that there's always, in the modules, there's a top, which is like a topical outline, and you want to make sure you go in there, although it's a lot of words about, course outcomes and student learning outcomes. At the bottom of that, it talks about what is the sequence in which you should do the events for the week. And so typically it's going to be read, watch the videos, do the discussion boards or other, presentations, and then do the quiz. There's also, like I said, a clinical assessment and clinical component that will be done weekly, and that will include things like every week your Typhon hours, your Typhon logs, and your weekly reflective journal. So the reflective journal you can upload directly into Canvas. You will find it under assignments and you can load them. They're in there currently as weeks, so it'll be week 1, week 2, for example. You want to be sure to upload your reflective journal logs every week you attend clinical. And if you didn't attend clinical this week, for example, I still want you to put something in there about a clinical reflection, whether it is your process with the organization or onboarding or whatever it is that is going on. It kind of clues me into what is going on in your clinical practice, so that I'm not touching base with you every week, but I'm kind of seeing, if there's any issues that are arising or anything that I kind of have to intervene on or be your advocate, right? So we want to be sure that these clinical experiences are treating you well. We want to make sure that they're treating you as students and not employees, right? And so the expectation is that you're there for this course in the beginning really to observe and kind of see the flow of the practice. I would say by week 2 or 3, you're going to start really trying to, see patients and do histories and physicals and really start to get the working phase down of the day. And it will progress, right? And so the more comfortable the clinician is with you, the more they will allow you to do. But I really, the scope of practice of an NP is really not to be drawing blood and answering the phone and, picking things up, right? Or, getting lunch for the office, for example. So I'm just saying some things that I have seen that really don't benefit you as a student. And so if those things are occurring, I really do want you to reach out to me directly because it'll be something that, I look for, especially when looking to see if we're going to use that site again, right? And so we want to just be sure that we're using a site that's going to give you the clinical experience you need because you are the student and this is your time to learn, okay? So you'll be doing those weekly. The Typhon hours and the case logs, again, should be in within 48 hours. If you are needing to extend that for whatever reason, please reach out to me. It is a pass-fail item. And so I would prefer, obviously, that you have these things done on time so that it doesn't affect your grade in this course. Okay, so moving down to week 2, we're going to start talking about ocular disorders. And so you'll see here, these are the chapters and the various books. You'll have a discussion board, a quiz, and your clinical assignments that are due. And this will be the week where the students will select the cases that they'd like to present, or at least the week that they'd like to present. Now, if you pick a week, like let's say, for example, you pick week 3, which is next week, right? The following week. And you see some patients, but they really don't align to the content, right? So I would like the cases to align to the content, right? So if you're presenting on week 3 and you are presenting head, ears, eyes, nose, throat, or sorry, not eyes, because eyes are week 2, right? But if you are picking week 3, I'd like you to present something that goes along with the content of that week. Now, is it required? No. But it's nice because then it allows us to live the case through you, and it reinforces the learning content for the week. Now, if it's not possible to, for example, by next week, you don't see somebody or in practice with any issues with the head, ears, nose, or throat, then I would work with you to pick another case, okay? I do want the cases presented, sent over and uploaded via Canvas on the Sunday so that they can be looked at, and I can give you feedback prior to you actually presenting it. So what I would recommend, and I'll go over this in much more detail with the rubric, I would recommend you kind of just lay the canvas out, start to fill it in, and then really have it in a draft form when you submit it to me so that I can really look through it. I'm not going to grade it at that point. I'm just going to give you some feedback, and then I'll tell you, okay, on your next submission, submit the real case, okay? And this is because this is your first time doing this, all right? Once you get to the next term in this course, you really probably won't need that much hand-holding as far as presenting a case, but I want to make sure that your colleagues are going to benefit from your case presentation. So I want to make sure it's something good, right? Okay, so that is the case presentation. I, again, will voice over something for you specifically for that assignment, but that is when we start to do them. So week 3, we start. All right, week 4, we go into respiratory. Again, discussion board, quiz, a case, and the clinical stuff will be there. Week 5, we go to derm. So again, discussion board, quiz, student presentation, and clinical assignments will all be there as well. And then week 6, we'll have our midterm. So the midterm will be everything up to and including from week 1 through 5. All right, there will not be any cardiology questions or content on your midterm. However, there will be things for that week, such as a discussion board in cardiology and your of course, your clinical stuff. Notice I did not have a student present a case that week. I felt that that was too much pressure. And so, all of you will be preparing for and presenting your midterm, okay? And, so we will discuss that as it gets sooner, closer actually, and so that will be on week 6. Okay. Week 7, you will have, again, discussion board, a quiz, a student-led case, and the clinical. Week 8 is the same format. We're going to be doing endocrine. Endocrine is broken up into 2 parts, part 1 and 2, because there's such a large chapter. Okay, same things are due. Week 10 is musculoskeletal. Again, another case, discussion board, quiz, and clinical items. Week 11 is neurological. Again, same things, discussion board, quiz, the case, and clinical. And then we go to GI. So week 12 is when there's no more cases. I tried to front load them a bit so that you can prepare for your finals towards the end. And so week 12 will start GI, and it will also go into week 13. And we will start to wrap up for your end of course. So week 14 will be the wrap up. We'll do our evaluations, and we'll still be doing all of our other items with clinical. And then week 15 is really the end, right? So you'll have your final exam, you'll wrap up all your clinical logs, your cases. I will approve your logs. If your logs are not approved, I'll be checking them often. And so you'll see if the way that you documented, if it's not in line with what we're wanting, then I'll unapprove it and you'll have to go in and audit it, right? And so you're going to get it there. I did post on your modules what is going to be considered a SOAP note, and I want you to use the SOAP note format for your Typhon clinical logs, okay? This will help you navigate your thoughts and kind of put it into a streamlined process so that you can have that and practice this, okay? All right, so the rest of the syllabus is the program outcomes, the essentials, the COVID policy, right? Some other things here. There's an attendance policy and things regarding late assignments that I should draw your attention to, as well as the policy on academic integrity and things like that. So, all right, so if you have questions at all about this syllabus, anything I can clarify, I did put a chat in week 1 for you to ask questions about the syllabus. So, you know, if you have anything, you want to put it there. Your other colleagues can listen to the responses, and so I can help you. I'm here as much as I can be to help you in this course. You can email me. Like I said, Dr. Lanfranchi will be primarily doing the didactic portion, and I'll be doing the clinical portion, but both of us will be working within the course throughout the week. All right, take care.